Dental Sedation Courses is pleased to announce IV Sedation for New Starters 2018, the latest IACSD accredited comprehensive intravenous sedation course. This is the first ever blended learning sedation course, making quality conscious sedation training accessible and affordable for dentists, and in turn making quality conscious sedation services accessible and affordable for patients, whilst easing pressure on secondary care. Here are 9 reasons why you might consider intravenous sedation training. You can increase the types and number of treatments offered to patients. You can improve patient comfort and care, whilst avoiding referrals to other practices and increasing inward referrals. You can improve the practice profile and attract new patients. It may help you acquire future health service contracts, and you can improve your income. Possibly most importantly, you can remove the stress of treating and dealing with anxious patients. Here are 10 reasons why you might choose to do this course. It can be started at any time and completed at your leisure. It is a combination of presentations, videos, quizzes and more. It is fully STAC accredited in line with the latest UK sedation guidelines. You can save time and money on travelling back and forth for lectures and study days, and you can re-watch and pause lectures and come back to them later. It follows the university diploma syllabus and more. It includes a full complement of free downloadable resources, from consent forms to risk assessments. It is presented by general practitioners with tips on how each section applies to general practice in reality. It gives you a full 12 hours didactic online study, followed by clinical mentorship by diploma practitioners. And you have the ability to choose your own mentor or avail of one of ours. Here are the course aims. It is a comprehensive didactic and clinical training in intravenous conscious sedation and anxiety management in dentistry, to allow dental practitioners to carry out independent conscious sedation practice as operator sedationist, in line with the latest IACSD guidelines. Time is precious. This course will not give you only the didactic knowledge of a conscious sedation diploma condensed into a fully online format, but also step-by-step tips, advice and free resources to start offering conscious sedation safely at your own practice. The course format. The course is in 2 parts. The first part consists of the didactic training, which is completely online. The second part, which is mandatory following the latest UK guidelines, consists of maintaining a log of your first 20 IV sedation cases. There are 2 ways you can complete this part. 1. We can arrange for a diploma qualified mentor to supervise your cases at your own practice. Or, more commonly, we can arrange for a self-appointed, experienced mentor of your choosing to be accredited to mentor you through your cases. Here we will list the learning outcomes of the course. And here are the 22 main areas that our syllabus covers, which you will see is comprehensive and clear. Here is a short example of a video from one of our online lectures. So, first, don your gloves. Take the midazolam ampule and check the date on it. With the red dot on the neck of the ampule facing you, confidently break the top off the vial. Use gauze when doing this to protect yourself from injury. Place the 21 gauge green needle on the end of a 5mm syringe and draw up the entire contents. You will sometimes need to invert the vial to get all of the solution, but as you see here, the needle does reach all the way to the bottom of this ampule. Resheathe the needle to remove the needle from the syringe, and with the syringe pointing upwards, depress the plunger a little to remove any air. Label the syringe midazolam and repeat exactly the same for the 0.9% saline solution. The syringes can be kept in a safe place on the worktop, or ideally in a metal or disposable kidney dish. As a group, dental sedation courses aim to produce accredited training in all aspects of sedation and anxiety management care, and we hope you can join us in improving patient care and outcomes nationwide.